Dr. T, thank you so much for joining us at Abu Dhabi Global Health Week.
It's an absolute pleasure. Thrilled to be doing this with you. So thank you for inviting me.
Tell me this, the conversations you've had over the last 3 days, where in your mind are we in the fight, not just to prolong life, but to live healthier lives as well?
So firstly, I do want to say something about the conference mission around longevity and well-being, which is such an important thematic focus as opposed to disease diagnostics or illness management. And the medical fraternity is quite good, right, with the disease profiling management, but the wellness, longevity part of things is where I think the right to health and the next reiteration of the work needs to focus on, because it really talks about dignity
and equity.
And beyond just accessing healthcare facilities, it also demands participation of people who are end users, who are rights holders, to participate in these very important and dynamic spaces around digital innovation, AI, and the different solutions that respond to their immediate needs.
How do you feel about equity today in the healthcare space?
Look, for millions of people around the world, the attainment of the realization of the right to health is still a distant goal. And because of the polycrises that we're experiencing, for many people, that goal seems to be even harder to reach. So I think the issue now around equity is, how do we really think differently about creating policy, creating space for civil society to participate in policy making and program design in a way that firstly responds to immediate, urgent, everyday needs, and also starts thinking about what is resilient and thriving communities look like. Because I think that's where the world needs to be moving. We are in survival mode. We are responding in retrospect to either pandemics, protracted war. And so the use of digital technology, AI, and how expansive it can be allows us to vision a world, for me, that I think should be around thriving and sustainability. And so what we do need to do, and when I always make the argument that the right to health is part of the bigger social system, we shouldn't look at health or healthcare or the right to health as isolated from everything else that happens in society. So we need economists who understand how the kinds of decisions they're making ultimately affect the realization of the right to health. We need underwriters and insurance brokers to understand when they exclude particular conditions that cover women's health, from how we get diagnosed to treatments to specialized interventions, when they cut us out of those benefits, what it actually means for gender equality, but for our own right to participate in the economy. So we need everyone everywhere plugged in to understand how they can make particular decisions that are different, equitable, to lead to more equitable outcomes, because the decisions themselves have to be democratized, have to be non-discriminatory to lead to better outcomes.
How do you see artificial intelligence facilitating that?
So artificial intelligence for me is not all good and not all bad. And I wrote a report to the Human Rights Council talking about digital technology, innovation, and the right to health. And what was important there was to bring two concerns: that there isn't a human rights standard for how we are going to adopt, utilize AI in the medical sector, in the patient-doctor interaction. We know that interaction is governed by medical ethics. We know that there's professional bodies who give us standards professionally on how to do that. When you add AI to supplement or enhance that consultation, what happens when things go wrong? Where does the fault lie? The other issue of AI of concern for me is the issue around data privacy, data mining, harvesting. Patients often will not consent, even though a product or a program is really good around AI and they understand the benefits. They fear that their data, they don't know where it's going. If there's a breach or a leak, they don't know who to hold accountable. Many of these multi-million-dollar corporations are headquartered outside of the so-called Global South, low-middle income countries. And so we need to have an understanding where business and their role in human rights is articulated, and they have a commitment to human rights, because then patients will be less worried that maybe their data used for research and development without consent, or it's used for marketing without consent, or it's used in many other ways, to inform and make more products for profits. So there is a legitimate concern, but the exciting part, I think the nexus of innovation lies where there are trustful partnerships between the multilateral system, between civil society, between individual stakeholders, but absolutely healthcare workers. And that collaboration takes time because we need to be around the table. We need to be talking and really articulating and breaking down all of the different impediments, because some solution may be great from a corporate perspective and not translate so well in a clinical perspective. But if we are not even talking, we won't get to the solution. So for me, it's more collaboration, more cooperation, more talking with the intention to find good middle ground. And regulation is not necessarily impeding innovation. Innovation is happening anyway, right? What I'm saying is a guidance, principles that are centered around human rights will be best for everybody. So being in Abu Dhabi for me is important because part of the mandate that the Human Rights Council gives is to actually advance human rights standard setting, is to collaborate with partners. And this has been important as a space because you have very high level governmental representatives here. You have duty bearers, exactly, collaboration. And we are meeting also in a different space. I often speak to member states at the UN in General Assembly or in the Human Rights Council. The conversation is different. So as a medical doctor also who still sees patients, I'm also absolutely delighted by seeing all of the different exhibitions and learning more about different technologies around early cancer diagnosis, childhood diseases, chronic illness, for example, but also something really special. Someone said, a lot of the products that are being made are actually going to look at how well you are, not how sick you are. And what we count and what we quantify is what gets invested in. So I'm hoping that we can keep up that theme as much as it's happening through individual dialogue of let's measure our health and wellness differently. Because what do we measure and what do we quantify gets understood in a particular way and therefore gets resourced in a particular way. So that has been really a big highlight for me.
Dr. T, thank you for joining us here in Abu Dhabi.
Thank you very much.